Hello, this is Dr. Jose Bolanos, and I'm happy to welcome you to a HIPAA Summit presentation. I have with me Eric Doherty and Eric Drew, and I'd like to start by telling you a little bit about what we're doing here. This is a event that will bring experts in the healthcare space and cybersecurity space to discuss how the healthcare system is being affected. Let me start by introducing Eric Drew. Eric is a pioneering expert in patient identity protection and renowned as the first individual to uncover his own identity thief and successfully prompt the first ever HIPAA prosecution in the United States. He achieved this groundbreaking feat while battling for his life against a terminal leukemia diagnosis. With an executive background in global business development across high-tech and med-tech companies, Eric has been a leading advocate for patient privacy, identity protection, and data security for 2 decades. I've known Eric for quite a long time here. He's been a good man. Eric Drew has delivered over 150 speaking engagements, including keynotes at prestigious conferences such as RSA Security, TED Talks, as well as presentations for the Secret Service and the U.S. Attorney's Office. His expertise has been featured on national television networks like Fox News, CNN, NBC, CNBC, and in segments on Montel, Geraldo, and Dateline, establishing him as a trusted voice in patient identity protection and data privacy. Now, Eric Doherty is a healthcare executive dedicated to advancing global health through innovation. His expertise spans artificial intelligence, data analytics, and healthcare commercialization with a focus on improving patient access, quality, and care innovations. He's held a senior role in large organizations such as GlaxoSmithKline, Abbott Laboratories, Uvanta Pharmacy Systems, AstraZeneca, Glock GmbH, and PersOwn. With a patient-centered approach, Eric's leadership drives sustainable technology-driven healthcare solutions. They make a tangible impact. And to tell you a little bit about myself, I'm a Stanford-trained OB/GYN physician, private practice for a number of years, 25 years, created my own electronic medical record system, and then developed the Nimbus Key ID solution. I'm the founder and CEO of Nimbus-T Global, and we're happy to begin here. So, gentlemen, say hello, and we're happy to begin the process here, and we'll get into the PowerPoint. Eric Drew, can you talk? I'll have each of you give a one-sentence intro.
Well, thank you, Jose. It's a pleasure to be here with both of you. Hello, Eric. Yeah, I mean, these breaches that we're about to discuss are horrendous, and I don't think that the impact on the patient population is being adequately addressed. I think the responses are not adequate, and we'll talk more about that. But this is a very important topic to be discussing.
Thank you. Eric Doherty.
Thanks, Jose. Really appreciate the time. And again, Eric Drew, great to have you on here as well. Again, with my background in healthcare, and as it's been in healthcare all my working life and all my life, literally, the need for HIPAA compliance has always been there. But obviously, with the inception of all of the AI that is out there in the world now, protecting that information is a key element for any organization that has personal health records or personal health information. And as we're going to discuss here, the impact, as Eric alluded to, has probably been very, very minimized. And I think the effect has been wide-ranging and ongoing. And I think what we're going to discuss here is going to be pretty impactful.
Thank you both. I appreciate it. So let me switch over to our PowerPoint here. And what we're going to do is we're going to take it one step at a time and have us each discuss our own viewpoints on each of these topics. So today's presentation, Change Healthcare Cyberattack exposes massive security gaps in healthcare data management. And this is actually an event that's going to be seen at the HIPAA Summit, HIPAAsummit.com. It's a very big group of doctors and cybersecurity specialists across the country. I'm very excited to be part of this. Now, Change Healthcare, this happened in February 2024. It was a breach affecting 27.4% of the US population, essentially 100 million individuals. 15 billion medical claims were not being processed. And Change Healthcare was processing almost $1 trillion in transactions. They got hacked and everything went dark. No payments to doctors and hospitals. So the incident was among the largest healthcare data breaches in history, exposing a vast array of personal health information, financial data, and medical records. This is truly a historic event. It was frightening. The government had to come in to help keep the healthcare system um, active. Initial findings revealed that the breach stemmed from vulnerabilities in Change Healthcare's server security, leaving healthcare providers and patients vulnerable to significant risks such as identity theft and fraud. Let me go on to this one. So, cybersecurity vulnerabilities and the entry point. What happened was Black Cat Ransomware Group, these guys have been doing some horrible things, responsible for the breach gained access through a server without multi-factor authentication, an essential security measure for protecting critical systems. After breaching this initial barrier, the attackers escalated privileges to access Change Healthcare's Microsoft Active Directory. And I know Microsoft been hacked quite a few times last year, allowing them to move through the network and control sensitive systems. Now, upon detecting the breach, Change Healthcare disconnected its systems and engaged third-party cybersecurity experts to investigate. They received a 22 million ransomware from Black Cat, and then they were extorted a second time by Ransom Hub. So it's been kind of interesting what we're having to deal with. So, Eric Drew, would you please give us some of your insight on this?
Yeah, I mean, the repercussions of such an attack have barely been felt yet. I mean, it can take years, and for the next decade, I'm sure we're going to see repercussions from it, although it may be difficult to trace back specifically to this breach. But I mean, I think what isn't addressed a lot, and I won't go into it too deep, but I think there's a fundamental shift, and there has been a fundamental shift in the way that we look at identity, right? I mean, when I was younger, I was, Eric Drew, 6'3", whatever, went to this high school, lived at this address. I mean, I had physical characteristics that you could identify and describe. Now our identities are a bunch of numbers flying around in the public cloud. So I think that we need to kind of come to some sort of a, you know, understanding about this fundamental shift and how much this puts us at risk as individuals and consumers. So I mean that's kind of a higher topic, but yeah, I think what I'm trying to say is that the depth of damage, and the scope of damage from this kind of an attack is just we haven't even seen it yet.
Yeah, thank you. Eric Doherty?
Yeah, thanks, Jose. The first question I'm going to ask, and again, these are folks that are listening in on this, is raise your hand. I know I can't see you, but how many of you were affected by the Change Healthcare effect? And I'm going to raise mine because I was one that was, but I'm sure that, yeah, Eric as well. And, I think there was probably, I would say probably 80%, if not more, that are out in this audience were affected by this somehow, some way. And it really was kind of a multi-step type of effect. You had obviously the billing issues where a lot of the providers, a lot of the pharmacies were not getting reimbursed from their billings or charges that were being made. That was one effect. And obviously some businesses were having some deep difficulty because of that. But then it's really, as Eric Drew alluded to, those ongoing issues that you have from a personal standpoint, things like affecting your credit, affecting, ways for you to get potentially credit card issues, et cetera, going forward. There's a really big pain element from a personal standpoint that can really take effect. And so I think, as a company, organization, as a hospital system, the ensuring of patient information is very, very key, and is not something to, really kind of use as a backdrop. I mean, it is something that should be at the forefront of any organization, and to really ensure that that data is not compromised.
Thank you. Eric Drew, since these cyber attacks are actually pulling not just name, address, and phone number, but they're pulling across your social security numbers, which is a frightening thing. And in your background and experience, tell us how how bad is that? How bad is it when they steal your social security number? What are they
Well,
doing?
it's about as bad as it gets. I mean, in my case, my identity theft case that you alluded to earlier, I was a very vulnerable patient. I was undergoing bone marrow transplants and very heavy chemotherapy treatment, everything for leukemia, and wasn't really able to, be on top of it, in other words, and fight back right away. So they were targeting, and these people, I don't believe it was just one guy, even though we nailed it down to one person, but
Did they actually create
they
new credit cards in your name?
yeah, so they didn't put charges on my credit cards. They actually opened over 10 credit cards in my name within a month. And the banks, it's just belligerence really on behalf of the banking industry. If the banking industry employed more security on the front end, then this wouldn't be an issue. But I mean, all they do is call. They don't even fill out an application. They don't sign anything. They just call and say, "Hey, I'm so and so. I'm Mickey Mouse, and I live at this address, and here's my social security number, and here's my date of birth." If they have those things, the address doesn't have to match anything. They issued credit to an address in a state I've never lived in and an address I never lived at. I mean, it was complete, like, again, belligerence. But all they had was my name, my social security number, and date of birth. If they have those three things correct, it matches up with their little quick credit check and they just issue the card. I mean, they had my mother's maiden name wrong. They had all the other questions they had wrong because they didn't know.
Wow.
But it didn't matter. The banks issued credit anyway.
Eric Doherty, from the standpoint of the security around this information, I remember Wells Fargo had some problems that some of their agents were creating credit card accounts out of thin air. Do you have any feedback on that?
Well, again, Eric kind of alluded to that, the issues with obviously just the basic information that can be, needed to open up an account. And so obviously that can be a great disservice to that individual and individual's credit. Where I come into play on the healthcare side is, it's the patient health information. It's the information about, their blood tests, information about maybe their imaging that they've done at a particular MRI facility, et cetera. And really taking it one step further, it's now getting into the genomics information where that
Right.
data that was basically in and localized within a health system, that information now has become public information. And that's really telling because, again, genomic information is literally you. I mean, it's your persona that is within that
Right.
data stream of genomics data. And so that becomes a big issue if it's out there and somebody else can impersonate you, et cetera. And that's just ongoing issues,
Good
unfortunately.
point, Eric. And then you also, point to the 23andMe breach and think of
Yep.
all the genetic data that was taken during that. And it's pretty scary. I mean, how are they going to be able to impersonate other people? They maybe, now with AI, you can create, video of people that look exactly like them. They talk like them. They sound like them. I mean, we need to really reconcile, how we're flagrantly using identities and what that means. Maybe get
Now,
back to a little bit more brick and mortar when that's concerned.
Now, one of the interesting things is that Social Security number is a tax ID for the citizen, but an NPI, National Provider Identifier, says tax ID for every healthcare provider, doctor, hospital.
Right.
And the critical component here is the federal government has a 5 GB file that anybody can download of every NPI number. And doctors are being hacked in. I have an experience of a friend of mine who is a plastic surgeon who a woman worked for his office for a month and left, and she stole essentially all the data on their patients. And they submitted an additional $250,000 in billings that came under his tax ID number. Quite a problem. So let me go to the next slide. So here, the immediate fallout and financial impact. The financial toll on Change Healthcare's parent company, United Health Group, is expected to reach nearly 2.9 billion by the end of last year. This is a massive loss for them. But again, based upon the revenues that they make, that's still a fraction. So we're hoping that the government can actually come in. As we said, 23andMe just got hacked and they had a fine of $30 million. So this could actually translate into forcing companies to truly spend money on cybersecurity. This is the digital world now. And as you said, with AI, we're quite frightened about some of the effects. Direct costs, including restoring affected systems, reimbursing health providers, and addressing the vulnerabilities that enable the breach. the government in later that year, healthcare, they presented Healthcare Cybersecurity Act that was introduced by Senator Mark Warner. So from the standpoint of the fallout, um, into the healthcare system, we're talking doctors that are operating with a 20% profit margin, having to employ 10 employees in a single office in order to be able to do the billing and the follow-up and the authorization requests. And, it's turned into a nightmare of paperwork, third-party administrators. Now they have AI that's actually you can dial up the number of denials on the request. It's frightening. We need to get back to where the doctor takes care of the patient, and that's where it's
Right.
at. We need
That's the brick and
Eric
mortar.
Drew.
I fully agree. Thank you, Jose. Yeah.
Eric Doherty.
Yeah, I was going to say, you mentioned 2.9 billion. That number overarching across the globe is probably closer to 9 or 10 billion as far as the actual costs that will be incurred. Just because, again, the folks that are impacted from a credit standpoint, obviously the billing issues from a provider standpoint, the pharmacy side not being reimbursed, and so that figure is probably very, very much a quarter, if not even a tenth, of what the actual impact is, which is unfortunate. And I think the big thing too, as you mentioned, Jose, the AI involvement now. I think that's good and bad. I mean, on the bad side, there are the bad actors out there that are using AI to the detriment of the good people out there. And so they've found ways to access systems. They've found ways to kind of navigate through a healthcare organization or even a corporate level organization. And because of that, that's where that impact is occurring, where they're able to get the data, be it from a individual's laptop computer in an office, or now again with most people working remotely, that access being on a remote basis. And so that has really driven, I think, a lot of the emphasis on making sure that systems are in place to protect the corporation, protect the hospital, protect the health network. I think the one problem, though, that I see is that it's not moving fast enough.
Yeah.
They've not put in the technologies, they've not put in the people or the systems in place to really ensure that this doesn't happen again. And so I know that there are activities happening in the background within a lot of these organizations, but it's not happening as fast as it should.
Thank you. Well, the government had to actually step in to, provide payments. I believe it was three. Uh, I can't remember the exact amount, but actually the government had to come in and begin paying the doctors and the hospitals during the interim time that Change Healthcare was fixing their systems. One of the biggest problems was patients couldn't get prescriptions. They had to go all paper-based, you know. And so all their systems got disconnected and you couldn't process. So it was really massive. So yes, one of the biggest problems in the process here, 80% of intrusions into enterprise systems is through the front door, usernames and passwords. And we haven't moved away from that fast enough. So what's happening, phishing attacks? They actually send you an email that says, hey, this is your boss, and you need to check in and log in and do this. So yes, the AI attacks are increasing the ability. I mean, for all you know, I could be an AI agent right now speaking, so it's really, really scary what's happening out there. So let's go on to the next slide here. The legal and legislative percussions. The breach resulted in more than 50 lawsuits alleging negligence in safeguarding personal medical data. Lawmakers like Senator Ron Wyden are advocating for stricter penalties for healthcare organizations found to have lapses in cybersecurity. Now, how would you, in addition to doing an assessment of the cybersecurity, doing pen testing and things along these lines, the IT departments at these hospitals and at these systems are very overwhelmed. Is there a way that we could simplify this? And I know there's CrowdStrike is a interesting player in the space that they actually use AI in the process of detecting any changes in a system, and they've done really well. Um, it, Eric Drew, do you have any insight into how we could
Yeah,
help
I
these
think that
systems?
obviously employing those types of systems are important, but it's after the fact, right? I mean, it's too little, too late.
Right.
Oh yes, we've been breached. Okay. It's about prevention. That's what's important. Now, I have at the same time, I have, sympathy and empathy for these private practitioners and small clinics, that are barely staying afloat, and they're having to do all this stuff, and really they're it's the reaction has been responsive. If the government requires it or it's a law, then they'll implement it, when they get to it. But if it's not required, it's just not, it's not going to be accepted. So I mean, things have to improve, as Eric Doherty mentioned. They have not implemented technologies quick and fast enough. They've got to protect that front door. Um, it's time to move beyond, passwords, username and passwords, which obviously are hackable, and they can figure that out. AI can figure that out pretty quickly. They can, they get all this background information on you, and the AI can figure out what you might use as a password and try a million different, combinations of it or whatever it is. So time to move beyond that. Thank you. For
Eric
sure.
Doherty?
Yeah, Jose, I think where things have gotten, I think, beneficial is that a lot of these large organizations are adding in what's called a chief AI officer. I think that's helping a lot, where you've got the folks that have kind of that background in AI, and they are putting in systems that hopefully will prevent breaches like the United Healthcare breach. I think a lot of it goes back to the training that's involved, and Eric Drew alluded to this too, where you've got to ensure that the staff, that the key elements within an organization are trained and trained very well on how to prevent these activities from happening, how to ensure that they're using the right connectivity into a system before being on a remote basis or even in the office basis, really to ensure that their systems aren't hacked. I think that's a huge benefit. And I think, again, just really making sure that you've got the systems in place to do the checks and balances to ensure the system is running properly, always running properly, and having the people trained properly to ensure there's no incidents that happens in the future.
Well, yeah, there's a significant need of advancing and educating the entire industry in order to have every employee or every person connecting to your system be aware of the potential misleading
Exactly.
emails or entry points.
It's also hard to keep up with. I think HIPAA compliance officers are, overwhelmed. Are they a policy person? Are they an IT person? I mean, what is their role? And I think that, it just gets, whose job is this, and who's responsible for what gets, needs to be defined, obviously.
Thank you.
Yeah, I'm going to just add one more thing. I think on the flip side of all of this is
Mhm.
really having a plan in place if it happens again
Right.
or has happened for the first time. So have something,
Well,
set up within the system to ensure that once something does happen, what are you going to do? What protocols are in place, and how are you going to operate if you do get breached? And really, I think that will help the organization probably protect as much information as they can. But also, again, you just have to make sure people are trained, and you keep kind of having maybe a quarterly or annual kind of redo
do
to
you know
ensure
any
that things are
company?
running
Do you
properly.
know any companies that are doing that? Is this
Yeah,
something that you did?
yeah, Mayo's doing it. Cleveland Clinic is doing it. So these large health networks are
Right.
are doing it. And I think, again, a lot of it is because of the stuff that's been happening in the breach element, and
Right.
obviously with the UHC breach. I mean, that was huge. I think that was a big eye opener to a lot of folks. That here you have this huge company. You think they're running well and having everything systematically organized. Obviously, they weren't.
Well, we're really happy that HIPAA, which is a regulatory body also that's mandating that we protect patient information, and so it's really nice to participate in what we're doing here. So the next slide, systemic vulnerabilities in healthcare cybersecurity. This breach has underscored the risk posed with centralized mega corporations in the healthcare sector. Again, when Change Healthcare is processing $1 trillion, 1/4 of the transactions, this is a huge problem. The high
Yeah.
concentration of data creates a single point of vulnerability. Industry experts now recommend that healthcare organizations critically examine third-party partnerships, conduct regular cybersecurity audits, as you're saying, implementing multi-factor consistently across systems. And I want to actually discuss what we're talking about here on the what we're talking about in advancing security. The definition of authentication levels, when you're logging in as a user to a system, There's single factor authentication. It's a username and password, single factor, basically a password. And there's 40 billion passwords on the dark web. And so they have access to this. Now with AI, they can actually penetrate faster. Two-factor authentication, the government is calling two-factor multi-factor, and that's an error. Two-factor adds a six-digit PIN through another Google Authenticator or other authenticator apps. And multi-factor adds a biometric. And Apple's the one that's done the biometric. The difficulty is that is not verifying the person. It's connecting a biometric to all your passwords. So on my iPhone, a criminal can create an account with my name on it and a new email, and their iPhone logs them in with their biometric. So this is a problem. So as I said, I'm the founder of nimbus-t.com or Nimbus Key ID and authentication solution. We do a true user verification on the mobile app for employees that will log in a more secure manner. And we issue keys called DEMFA, dynamically encrypted multi-factor authentication. So whereas the bankers at Chase Bank have to remember a 16-character password that actually has to change every 3 months, this is much more efficient in truly verifying the user that's logging into the system and issuing dynamic identity QR codes and PIN all within the phone. So that's kind of cool. The other thing is, as I said, 4.5 trillion in transactions. Nimbus is part of the FedNow system. What we're saying is logins to data systems should be enhanced past multi-factor with true user verification. And that's, again, we have a patent on the Nimbus key system that is hopefully we're looking at protecting the entire digital world in this regard, AI systems and enterprise systems. AI systems for internal monitoring of illegal access. So we've talked about that this is really an important. So the entry point is the biggest open hole. Once they get in, you want to make sure that they're not on your backups, and you want to make sure that they, aren't they didn't actually extract 4 TB of data from your system, and it's a little too late. So advancing authorization processes with AI and fast digital pay. The new FedNow fast pay system, which I'm showing here, the federal government is now, this is the future of payments. Right now, an ACH or SWIFT payment internationally takes 4 days in 3 banks. This new ISO 222, it's an encrypted XML data structure that allows for international transactions in 6 seconds. So this is the future of payments. There's no need for third-party administrators. It's all digital. You bill X and you get paid X or 30% discount off X. Right now, what's happening in healthcare is the contracts with insurance companies are contracting to discount anywhere from 70 to 90% in some instances with hospitals. It's turned into a nightmare. So this would advance the stability of delivery system in healthcare if you send a bill and you get paid now. And the entire crypto world is actually also under this new ISO 222. Payments. Eric Drew, would you like to have a little phone app that has a QR code that then you scan it and the doctor says this is a $250 visit and he or she gets paid instantly and the money actually came from a debit account that your company had already set aside for you to pay for outpatient services?
I think that we could be doing. I think the whole billing system is just it's so bad it should just be completely thrown out and restarted. I mean, the fact that they're getting paid 20%. I mean, so then they just charge 5 times more so that they get it's a mess. It's
Right.
an absolute mess, and it makes no sense at all. Um, I think I said in previous conversations that when something is this far out of whack and it's not being changed, it's because somebody's benefiting from the way it is. If you follow the money, either it's the insurers who are the way that they're regulated and they're getting around that by having this crazy whacked out, you get paid 10% on what you bill and this and that. I mean, I don't know, I'm not an expert in it, but there's got to be something there. And if we follow the money, we'll figure out who's benefiting from the way it is and why it's not changing. But that it just needs to be scrapped. I mean, it's crazy. But yes, I would prefer if the providers that I see got paid very quickly and got paid 100% for what they're worth. I mean, that Obviously I've been through a lot of medical care. I've had a lot of procedures done, with the leukemia and everything. And it's crucial that those providers are taken care of.
Thank
And they're
you.
not being taken care of.
Yeah, thank you. So it's fascinating because what we're talking about is when I graduated from residency, I went to UC Davis and then Stanford. But when I graduated, a day in the hospital was $2,500. And it was an 80-20 split. The patient paid 20%, and the insurance paid 80%, right? And then today, a day in the hospital is $50,000. 7 days in the hospital is $350,000. And the hospital's getting paid anywhere between 10 to 30% of that bill. I actually had an experience like that, 7 days in the hospital, $365,000. The hospital got paid like $150,000. Then one time I had a kidney stone, 6 hours in the emergency room. IV fluids, pain medication, past the kidney stone. Bill was 16,500 and the hospital got paid $1,500. This is the nightmare. We need a free enterprise. We're not a free enterprise. And the insurance company, it's just a lot of criminal. Everybody's getting money except the system. Eric Doherty.
Yeah, just to add to that, I think one of the things that we've also seen, and again, for the folks listening in on this and viewing this, it's the PBM structure as well, where you've got the PBMs that are owned by the insurance companies in most cases. And so, again, where does the money go and trace and track that money? So that's a considerable issue, I think, from a economic standpoint within the healthcare world. I think the other kind of added thing that I just want to kind of point out, the need for, again, the security, the cybersecurity end of things and the protection of the data. If we have a system in place where I can use an iPhone, access the data, have payments made, et cetera, Nimbus is actually that product to do that. And I think that's really where the bottom line is for this presentation from a HIPAA standpoint, privacy of the information, from a health provider standpoint and a health patient standpoint, but also the payment side of things is hugely, hugely relevant to both sides of the equation within the healthcare setting.
Thank you. When you say PBM, that's the same as TPA, right? Third party administrator. They
It
actually.
would be similar. It's the pharmacy benefit manager. So it's
Okay, okay, okay. So that's on
basically
the
it's the
pharmacy
system
end.
that,
On
yeah,
the
it's a
doc,
pharmacy.
yeah, on the doctor end, like I said, you submit a bill and it goes to a third-party administrator who then looks at the contract. Oh, that was $100. Okay, we're giving you an explanation of benefit, an EOB. Here's your $30. You're writing off 70, or put it in $1,000, and you got paid, $300, and you're writing off $700. So it's turned into a nightmare what they're doing. So let me continue here. Thank you very much, guys. This is really very exciting. So here is the Nimbus Key ID system, an advanced login system. As I said, it does true user verification with KYC AI biometric. At a bank, KYC ML, know your customer, anti-money laundering. When you set up an account, you have to give them a picture, your driver's license, your blah, blah. You have to give them so much information so they're verifying that you are really you when they set up your account. And this is happening digitally. So we actually are doing a true user verification of the person when you create your account, and we connect that to the company that you're logging into. It could be a hospital, a bank, um, and you see a QR code and a PIN all within the phone, so you don't have to go somewhere else. So this is the foundation of a true user verification, the ability to authorize the user that you know who they are, and the keys cannot be stolen, reused, or decrypted. The keys change every 5 minutes. So there's no passwords, no static vulnerabilities, and there's an ease of integration with existing systems. So this is a custom backend connection to enterprise systems. So in summary and final thoughts, stronger digital ID for login systems, more sophisticated encryption of login keys, educating employee base about cybersecurity responsibility. Employers need to focus on the protection of data. Eric Drew,
Mhm. Yeah.
tell me your final thoughts here that we want to
Well,
convey
I think just
to the audience.
yeah. I mean, out of everything we've covered here, I mean, I think the key points to pull out are um, that protecting the front end is paramount, right? And if 80% of these breaches are through the front door, then that's what we need to be addressing. And if having, doing away with passwords, having a dynamically encrypted multi-factor authentication, true multi-factor, right? So it's not
Mhm.
two-factor, it's multiple factors that are verifying the user. is a solution that everybody should be looking at.
Thank you. Eric Doherty?
Okay, thanks, Jose. Yeah, I think again, 20 years ago, when the real HIPAA rules were being put in place, everything was still being used with paper. And so,
Yep.
as we move now into this digital world, the key element is we're in the new digital world. AI is part of this digital world. And so, systems need to be in place, the training procedures need to be put in place, the protocols need to be put in place to really ensure that your systems are protected. And when it comes to HIPAA, when it comes to PHI, NPI, whatever acronym you want to use that has something to do with security and information, you've got to make sure you've got those systems in place to protect that information. And so if you don't, you're going to get hacked. If you do, you may get hacked. But at least you're protecting yourself. You're trying to protect yourself. And that's a key element to really kind of key in on.
Thank you
Um,
so much.
I
Eric?
just want to interject real quick. So there's you have this other issue, right, which is the single sign-on, and then you have multiple apps. So when somebody gets in, it's catastrophic, right? So I wonder if just there's a way that the Nimbus technology can be used to sort of protect levels. So even if they gain access to one application, they don't necessarily gain access to the others. That somehow there's an
That's a good point. That's a good question. When you talk about enterprise systems, they have a administrative panel, and like for instance, Microsoft has it was Azure Active Directory in the past. Now it's called Microsoft Entra. And essentially, if you have 1,000 employees or 10,000 employees, the admins of those systems have already given you specific permissions on what systems you can log into. So when you log in, the system knows who you are, supposedly, with a username and password, and then you have permission to ABC. But if you're in IT, you have access to A, B, C, D, E, F, G, the entire profile.
Sure.
So a criminal with the admin credentials will cause a massive problem. So the single sign-on that you're talking about, there's a term called IDP, Identity Provider. Google, Microsoft, Salesforce are IDPs, but they log you in with two-factor authentication. Nimbus Key ID is a layer outside of that. So we're not messing
Right.
with your administration. We're actually securing the person's login. So we're an IDP in front of an IDP is what it amounts to, where they're
Yeah.
not using username passwords or two-factor. They're using DMFA and what we're doing in a much more secure manner. So
Excellent.
I'd like to thank everybody. We've done an incredible job here, and we're going to be looking at expanding these podcasts to cover cybersecurity in healthcare. And the world needs to advance because, as I said, we're not very healthy as a nation. We need healthier protocols to make our population healthier, lose weight, exercise, go out and take care of yourself. So thank you all. God bless, and we'll see you again on another podcast. Have a good
Thanks
day.
for having us. Yeah.
Thank you.